bode well for you or for the rest of us, really. It just turns into a shouting match.
All she has, because she has not looked into who I am or what's gone on with.
I don't need to look into. Well, look. Yesterday. Where was it? It was yesterday. She turned around and said to me, "I need to research my enemy." Yeah. So I researched my enemy, and the first thing that came up was her dead dad. So, like, what do you want me to do? And I figured out why you're so obsessed with Danny, isn't it? Because your dad's name was Danny, isn't it, Voldemort? That's why you're obsessed with Danny. You got this weird obsession, like it's weird. But anyway,
I didn't know that.
Yeah.
Ah, right, okay.
Yeah. But let me keep the smoke for later.
With my children, she's jumped on a bandwagon with paedophiles, knows she's fucked up, and now all she does is go to my dead dad and kids.
We are the stock in the enemy that falls from your
or what's gone on with
I don't need to look into. Well, look. Yesterday. Where was it? It was yesterday. She turned around and said to me, "I need to research my enemy." Yeah. So I researched my enemy, and the first thing that came up was her dead dad. So, like, what do you want me to do? And I figured out why you're so obsessed with Danny, isn't it? Because your dad's name was Danny, isn't it, Voldemort? That's why you're obsessed with Danny. You got this weird obsession, like it's weird. But anyway, yeah.
Oh, right, okay.
Yeah. But let me keep the smoke for later.
with my children, she's jumped on a bandwagon with paedophiles, knows she's fucked up, and now all she does is go to my dead dad and kids.
Bode well for you or for the rest of us, really. It just turns into a shouting match.
All she has, because she has not looked into who I am or what's gone on with.
I don't need to look into. Well, look. Yesterday. Where was it? It was yesterday. She turned around and said to me, "I need to research my enemy." Yeah.
What you did set my world alive.
And the first thing that came up was
Set my world alive. Set my world alive.
What you want me to do?
You get what's coming to you. I was searching. I was thinking. I was thinking about never in your ocean. I was breaking. I was left out. You get what's coming to you. I was waiting to be played in. I was left to tell the devil that win. I was searching. I was left out. You get what's coming to you. You get what's coming to you.
Bode well for you or for the rest of us, really.
All she has, because she has not looked into who I am or what's gone on with.
I don't need to look into. Well, look. Yesterday. Where was it? It was yesterday. She turned around and said to me, "I need to research my enemy." Yeah. So I researched my enemy, and the first thing that came up was her dead dad.
Skin in it, like in a baby skin, and they take it out.
So, like, what do you want me to do? And I figured out why you're so obsessed with Danny, isn't it? Because your dad's name was Danny, isn't it, Voldemort? That's why you're obsessed with Danny. You got this weird obsession, like it's weird. But anyway,
The one that I like, the one that I showed my mum in the shoe shop in Grand Cross.
But let me keep the smoke for later.
It's got a big star, and it's baby skin, but it's not like, it's not, you can do it coloured, but it's not like, it's a bit see-through there.
For the skin?
Yes, it's skin.
Okay, well, sorry to...
A big black star, it was... Wait, pause. I have to go and draw the star picture.
Okay.
The paper's downstairs.
And you're all having your little digs at Kaylee, aren't you? Yeah, so it is true. Everyone's had a row with you. Until they understand what she's fucking saying. It took me a while. I'm not going to lie. But that's probably because of the duress that you cunts under. Take the proper hand wrists. Because they'd started on her a good fucking years before they started on any of us. The A1000, because A1000 was over there on her own, it was a lot easier for me to decipher that she had something that she wanted to get out. That something had happened and that she needed to get it out. I could understand it with A1000. I could take my time, just think, Kaylee, so much around her, wasn't there? You bastards. Should be ashamed of yourself what you did to that woman as well. Destroyed. Meanwhile, you got all the little hangers on and you're funny. And it's funny, eh? Let's pick on another woman. Just don't pick on. I know that I'm ugly. Fucking cunt. Yeah, you cunts, that's what you are. You don't care about kids. You don't care about women. You don't even care about you. Got no, none. Got no. And then you want to try and have the cheek to tell me that I can't maintain mine. Well, I can, and I will. So, Dave, you fat lump, you piece of shit. And I don't care what weight you've lost. We'll all remember you. The drunken, fucking, alcoholic cunt here and was abusive to everybody. And the one person that reached out a hand to you, Dave, was me. And you're not going to be able to rewrite that piece of history.
I've just loaded legend up and I can see a real.
So whatever it is that you think of me, whatever it is that you thought I did to you, oh, by suggesting, oh, why don't we go and get some cartoons and enjoy your fucking the min that are this. That propagationist group. Enjoy it. Because I don't know how many times Haley's or Den's going to try and explain it to you. You just don't get it, do you? It's just too fucking
grab a message out the yellow hand will help you up. Miss the road, but don't despair. You'll be alone while
when all you've done is stirred up trouble for yourself, consistently.
you're gone and watch you flowers on the running of the
Who are these 20 special
There's
children?
Millie, she's a brown girl.
Millie who?
Millie Cowell.
Millie Cow?
Yes.
Okay. So how do you know she's one of the 20 special children?
Because I know because she comes and they do sex to her, mostly.
Who's they? Who's they?
The teachers, the parents, the staff.
Every single teacher or specific teachers?
No, every single, the whole school does it. The whole school, and we got our own church too, because they do that. Because after, as I said, we kill babies, we drink their blood, we eat them. But then after, so the social services who are in it, they go to families or.
Put in there. I didn't know what else to do. I mean, if he really wanted to commit suicide, there's nothing I could do about it, but I wasn't going to make it easy.
I think that I swallowed that shit for, years and years.
Any questions or comments from the committee? David Cope.
Commander David Cope of the United States Navy. I'm a 2007 graduate of the Naval Academy at Annapolis and a 2012 graduate of MIT with dual engineering and architecture. At 32, I'm a disabled veteran, soon to be medically retired from the Navy due to chronic health conditions resulting from the use of the benzodiazepine Ativan as prescribed over several years. Risk, demand, inform benzodiazepine. Not regain my sir. I'm not affiliated with any organization.
The Dave that I fell in love with was, he had so much energy. He was the happiest person I'd ever met. He would go sailing, biking, or hiking, and he was kind and he was patient. I mean, we talked for hours on end about all.
I was a waitress in New York City. Pretty normal girl doing things, nothing exceptional, nothing not exceptional, just normal. My mind was clear. I was happy. The only little issue I had, I couldn't sleep. I'd get out at 2, 3 in the morning. So I knew that my sleep issues were related to working nighttime. So I went to my doctor, just my regular doctor. I would see him maybe twice a year. And I asked him for something for sleep. And he sleep, just right prescription. If you want that, you have to get it from a psychiatrist. I then said, yeah, sure, why not? He gave me a referral, called a bunch of psychiatrists, and this one doctor in Brooklyn said, yeah, we're seeing patients, come on in. He gave me a prescription for lorazepam. He told me to take 2 in the day and 2 at night. I then, sleep said that. I said, okay.
That's me putting on the first time. I just got back from Iraq. That's all my brothers. And this sister is a waitress now. I used to drive her daughter to school, and I just had like the worst. Like the school is gonna blow up, all the kids would be dead. And then like that thought created adrenaline. So then when the adrenaline kicked, I was like, oh my God, am I going to be the one that does it? And then I'm like sitting here, thoughts are so teeth chatter. Like, oh my God, I'm capable of that. Are you kidding me? And then you get horrified because like, you're like, why am I thinking this stuff? This is not like me. I don't want to do anything to anybody's kids. I love my niece. This doesn't make sense. Why am I thinking this? I don't mental it's part because I don't know. It's my normal, like, did Effexor do this to me? Did Cymbalta do this to me? Did Geodon? Which one?
Just thinking ahead, thinking what comes next. My mom, yeah, I think she would call me the worrier of the house. I worried about the unknown, you know, things that weren't in my control, and I would overthink them. My anxiety a destroyer based out of Mayport, Florida. And then when you're at sea, you're training to be the guy directing this ship, where to navigate, where to go. It's great fun, but it's also extremely high stress. You know, stars have aligned, and I was really happy. Fall semester went off, you know, without a hitch. I had started a romantic relationship early. Later that summer. The early spring is when things started to fall apart. My romantic relations were taken, and Zoloft. They work as advertised. I mean, it's very immediate effect. It's very calming. Distinctly, the first time I was concerned about it, I was a teacher's assistant. I said, "Doc, help me," and the solution was diagnosed me with ADHD, put me on amphetamine, and from that point on, about 6 to 8 months beyond that, everything was grand. Yeah.
kind of fairly normal now.
It was great, loved it, back to my normal, what I thought was my normal self. Period is just a blur. Like I was a zombie, had this big wedding planned. I can remember talking to my mom prior to it. I was, Mom, I feel nothing. I feel when I went to the psychiatrist and
it's going to be open. Close the lodge. It's a
a lot. I feel very comforted just being around other people. When I was 11 years old, I moved from Nashville to Milwaukee, Wisconsin. We moved a lot. In the music, I started school. I eat. I had a stomach ache.
do you think? Yeah, how totally freaked out and got an appointment the same day.
And then toward the end, the therapist asked me to come into the room. She said, I think what would really treatment is for her to get on antidepressants. Wait a second, for the talk therapy, right? We didn't come here to kickstart it with medication. That's the whole point of going to a therapist, I thought.
Prescribed Zoloft for the. She didn't feel any better. She also didn't really feel. So when we saw her again, the doctor switched her to Prozac after I had a business trip. And I got a phone call that said, this little girl. And I'm like, what do you mean? Yeah, she's not really there, but I can see this.
I genuinely thought that there were people here in the room that weren't, but very real for me. I knew that they weren't there, but they were there, and I couldn't explain.
And I said to Rebecca, well, does it scare you? And she's like, no, not really. Alice seem to do much, so it was a benign hallucination at that time. Didn't want to.
The real, not real pain sort of interacted with me. That was always what kind of kept me in check with reality. They're not saying anything, they're not doing anything. They can't touch you, they're not there, it's fine. Yeah,
she came and the kitchen.
This she needs.
Even know people could have sleep issues because I was sleeping normal all my life. So it's not something I thought about. But I had a feeling it was my job. I just didn't think I could quit my job. I thought I could get help for it. That's how come I went to a psychiatrist. And he prescribed me this drug, lorazepam. I took it for 6 years. And
Wait, you took lorazepam for 6 years?
6.5 years.
Unfortunately, that's the problem that most pharmacists see with lorazepam. Lorazepam, again, if the doctor takes the time out to read the package insert, it clearly states.
Are they not reading?
That I don't know. I can only tell you what I read. The package insert from the manufacturer clearly states that lorazepam is only for short-term use, maybe 2 to 4 weeks. The lorazepam hasn't been studied for long-term therapy.
I asked him, I said, can I take this drug? Are you sure it's not dangerous? You sure I can stop when I want? And he said, yes, yes, yes. And it did help me to sleep. I slept like a rock.
The use of benzodiazepine has increased tremendously over the years. Since they've been around for such a long time, a lot of doctors have forgotten about the side effects and the possible dangers of these medications. None of them were ever meant for long-term use, but everybody knows somebody who's been taking benzodiazepine for years.
The doctor too much. I started thinking like, okay, when did this start? How did this start? What led up to like me falling apart? Like I was the go-to person in my unit always. If they needed a job done, they needed it done right, they would ask me. I was physically fit, knew my job. I got promoted to sergeant. After work, I was like a lot of fun. I like to travel, go to the beach, spontaneous. I was just like the happy person, like the happy-go-lucky friend. Like, hey, let's go shopping. Let's go to a bakery. Let's, never had a second thought about anything crazy. That's who I was before this. So when the war started, I think most of it was stressful situations every day, like being shot at on convoys, just driving around in dangerous areas of Baghdad. Your head was like constantly like scanning for something dangerous. All the soldiers in my unit would say, I have a letter from my mom. It's in my pocket of my flak jacket. Or I have a letter to my dad. It's in my helmet. So if I die, please give it to my parents. And then I said, I'm not writing a fucking letter because I'm not going to die in this. Sorry. Like, I'm going to be a strong sergeant. I don't take no shit. That's just the way I was. But like the first 2 months I was in Baghdad, like I'm really, really sick. I had nosebleeds, fainting, dizziness. I lost like 40 pounds. So they medevaced me out of Iraq. Then my convoy got hit the day after I got medevaced. And so I saw the kid come back in and he was one of my soldiers and I felt horrible. And like, that was the day that I saw psychiatry with the arrow and I walked straight there because that's what you do. I don't know. And they put me on Klonopin.
Right.
That's how this all started.
They're trained while they're on active duty very, very systematically that if you come back and you have problems, you need to go to the doctor. 100 years ago, if they had this kind of a trauma, would talk to their fellow soldiers, talk to their parents, talk to their friends, talk to their pastor. And instead they're going to their doctor and getting medicated.
I saw the sign for psychiatry. I walked down the hall. I remember it was just like a really small office and I was sitting in a chair and I told, it was a major. I remember that. And I said, sir, every time I hear a door slam, it sounds like a gunshot. My mind is racing, like I need help. And then he said, oh, just take this medicine. It'll make you feel better. And I just picked up the prescription and started taking it. And I think the Klonopin was starting to make me worse, but they just kept telling me that's what PTSD is. You have PTSD now. And then I remember he looked at me and he said, we're going to start the proceedings for medical retirement. You are not able to be around soldiers and no weapons. And I remember feeling like, how was I like super soldier? And now I'm disabled at 25. Are you kidding?
There is a post-traumatic stress, and it's a problem. So we would never argue with you that it's not a problem. It is a problem. It's a big problem. But for you, it's not a mental illness.
Like, I feel like I'm waking up from a nightmare. Like, what the fuck just happened to my life?
You lost years of your life. You lost your career. There's just so many things that are losses in here. That's part of the situation that we're in right now as a culture. Is that if you run to the doctor and cry about this, they're going to say, oh, you have major depression, and you're going to stick you on the next pill instead of saying, hey, you know what? Suffering is the only normal response. There's a grief process
I'm
that you have to go through.
Yes.
Wow. Let me tell you a little bit about myself. Actually, what I'll do is for the military in here, there's my resume. This is what my children love to point out to. I have daughters and they love to point out to their boyfriends, like, don't mess with me because my mother's not going to miss. I'm a board certified clinical psychologist. So I'm going to talk to you about science. I'm going to talk to you about reality. I'm going to talk to you about the research. People come home from war and they're frequently grieving and suffering tremendously, but none of that's pathology. It's grief. One of the things that's happened in our culture is that normal has been confused by marketers of all kinds with comfortable. Okay, so if you're in a normal state, you must also be in a comfortable state. And if you're uncomfortable in any way, there's something wrong. You're abnormal. Not one thing in the DSM-5, this book, the Diagnostic and Statistics Manual, the 5th edition, the Bible of Psychiatry, Not one thing in there is isolated by science. There's no physical findings. There's no PET scan. There's no MRI. There's no blood test. There's just behavior that has been described by psychiatry and labeled aberrant. It's outside of the normal, what we consider normal. And they set a cutoff, and then they voted into this book. Okay, how did we decide that how long you could have acute stress disorder was 3 to 28 days? A committee sat around and said, what do you think? How many days should people be in acute stress? And they said, I don't know. How about let's go with 28 days? Why 28 days? It's 4 weeks. It's 4 outpatient visits. It's a beautiful billing cutoff. It seemed right. All in favor? Bam. Those are the clinical criteria. The power that I had as a military psychologist to say, you are not normal. I could destroy your career. I can send you home. I can label you with something that you can never overcome.
My name's Alan Francis. I'm a psychiatrist, former chair of psychiatry at Duke University, and was the chair of the DSM-4 task force, which established the definitions for the diagnoses of the various mental disorders. Normal's in danger. The definitions used in psychiatry, and even more the way they're applied, have become so wide that a far too large percentage of the population would be defined as having a mental disorder.
Now we have patients come in, and if there's, they're anxious or they can't sleep or they have some kind of physical pain, it's like, oh my gosh, let's get rid of that. We have really vilified pain. And I'm talking emotional pain, physical pain. Like, it has now become the responsibility of the doctor to eliminate all suffering at all costs.
Some patients require the very closest in psychiatric and medical supervision, very, very tough problems. But most people presenting to a GP for anxiety have a short-term stressor that's making them feel terrible. Most of the symptoms will go away in most people within a few weeks or a month. We shouldn't confuse normal sadness and normal anxiety with mental disorder. And that line has been terribly blurred.
There is a cultural context, and the context really goes back to the arrival of antibiotics in late 1940s and then the polio vaccine. They really do change life. Bacterial infections are no longer a problem, and now we have this magic cure for polio. So now we believe in magic bullets. Pretty soon we're going to be having magic bullets for everything. What you find in psychiatry, if you trace its history, that is, in the 1970s, American psychiatry was in competition with other therapists for talk therapy, counselors, social workers. What do they say to themselves? They say, we need to present ourselves as doctors, as medical doctors. We need to put on a white coat. They adopt a disease model for categorizing psychiatric disorder. We're going to say these are diseases of the brain, illnesses of the brain, that our drugs, therefore, treat the symptoms of those illnesses. It centers on this chemical imbalance theory of mental disorders.
What I was taught in med school was that depression, for example, is a genetic chemical imbalance in the brain affecting serotonin, and that it's corrected with a pill. And there is this understanding that if you're manifesting with depression, that this is you, it's who you're going to be. It's like a destiny. And that implies taking medication, often for life.
It hasn't been possible to demonstrate that first you have a chemical imbalance, and then because of that you become